Hi, everybody. Once again, your friend Dr. Salim is here with you guys. I think it's a little important to talk about a few knobologies, a few knobs from the knobology. So let's discuss a few knobs from the knobology, which we use it most commonly in our ultrasound department, specifically if it's any of the if it's a vascular Doppler, if it's a general abdomen, small parts or anything. But let's talk what are their functions and how we use it. Let's do this series for a few video clips. So today we will talk about a few of them, some of the knobs, and let me share the keyboards of the ultrasound machine with you guys. Be with me. Let me share this. Okay, so I hope all of you can see the knobs here on the machine. So most of the machines have these knobs. And some of them are a touch screen and some of them are visible. You can see them like this machine, which is a QSON Sequoia machine, C512. So this is one of the machine we can see. Let's talk about a few things. For example, this is one of the knob. First of all, a few things I should say this. I know you guys understand it, but just to confirm it one more time, these are the knobs and these are the toggle switch. And these are TGCs, we can say. So in some of them are kidney buttons, they call it. Some of them are soft buttons, they call it. So they have a different names. So let's talk about this knob, which is a dynamic range. What is this and why do we need it? And where do we need it? What is dynamic range and what it does when we need to use this? So dynamic range is actually, it's the shades of gray. We all know the pictures, when we see any of the picture, it's made of a lot of shades of gray. So now to have a better image quality in a specific areas, for example, if I want to look to a structure which has inside, it has a liquid fluid filled area, like for example, a chamber of the heart, which is a blood, urinary bladder, which is the urine, gallbladder, which is the bile inside, cyst, it's just a fluid, or others. So this way, we want to bring our dynamic range, decrease it. So it will give you the best image quality. Why? How it will give me a good image quality? Because it will ignore all the low-level echoes, which was coming from that liquid, from that fluid. Any type of fluid can be, like I said, it can be a bile, it can be urine, it can be just simple fluid, it can be maybe like if you're looking for pericardial effusion, pleural effusion, so it can be any of the fluid, or it can be blood in a vessel or in a chamber somewhere. So we don't want to see those echoes because those are not desired. That's not we want to look for. So that structure, bring your dynamic range down, make it down. So it goes by percentage. Bring it more lower percentage. If you're looking for any structure which is fluid filled, this fluid can be anything, like I just mentioned. And then if you're looking for a structure which is a tissue, like it's a dense tissue, like a liver, like a spleen, and others, or thyroid tissues. So in that case, you can increase your dynamic range, and the percentage has to go more close to the 100%. Close to the 100%. It just depends how your picture looks like. Of course, we have to look for the picture as well too. So that is a knob. It is called dynamic range. That's how we use it. Now, there is another button, sorry, not button, knob, and that's called position. You can see here, or it says trans zone. What is this for? Most commonly, we use this for to increase the numbers of the focuses in a sound beam, or to position the focus where you want to put it, because that's how we want to see. This is the lateral resolution. This is for to make your lateral resolution the best. So we put the focus where exactly our target tissue is. For example, I'm just giving you an example. If you're looking for echocardiography and you want to look for the mitral valve, so put your focus by the level of the mitral valve. Or if you're looking to thyroid tissue, for example, and you want to see the isthmus portion of the thyroid tissue, so put your focus where the isthmus is. Or if you want to look for one of the lobe, like right lobe or left lobe, so bring it there. So this is actually has two functions. One, to increase the number of focuses. Sometimes it's a need to make a better image quality, to make your lateral resolution the best on the whole picture. So then we increase the number of focuses, 1, 2, 3, 4, 5, 6, 7, 10, 8. So we increase them. That's one thing. And secondly, we turn the knob to the right, to the left, to see where we can put our focus, because we have to put it at or just below of the target tissue where we want to see the interest of area. That is called position. The third one is a depth. We all understand it can be a knob like this, it can be a toggle switch like one of these ones, or it can be a touch screen. So any of these things will be the depth. So the depth is also very important for the frame rate. Also, we don't want too much depth. If you're looking something superficial, it's not too deep, then we should decrease. We should have less depth. If you're looking to a structure and that is in a 2 centimeter, why I should have 4 or 5 centimeter depth? It will bring your machine slow down. So make sure to have the depth proper. And what is the proper depth? That's a good question. So if you're looking to a structure, make sure to have that structure and below that extra 1 centimeter. Do not make it more than 1 centimeter. Put it just extra 1 centimeter. If you're looking to a structure and that structure is, for example, let me give you an example. You're looking to thyroid tissue. You can see the whole thyroid tissue and 3 centimeter. So make sure to not make the depth more than 4 centimeter. That 1 centimeter has to be just extra to see the neighborhood. If there is any pathologies or any abnormality, we can catch it. So that is the depth. And depth has a lot effect on the frame rate. If you decrease your depth, like if you decrease it, make it shallower, your frame rate will be a lot higher. And frame rate, you guys understand what is a frame rate? Frame rate is the number of pictures per second. So the machine will give you more pictures. You will have a lot of more chances to look for the best picture for your diagnostic purposes. You can use it. So that is the depth. The last one here is that is called a 2D gain or receiver gain. So this is a button or brightness mode. We try to make our picture, entire picture, to make it equally a reflection from all the tissues. We want to see the reflection or the echo texture or the brightness equally on the entire picture. So that will be our 2D gain. If you turn it to the right, it will make your picture brighter. If you turn it to the left, it will make the picture darker. So it's just due to need. Sometimes we need to make our picture brighter and sometimes we need to make it lower. So that is actually amplification. So this knob is for amplification, to make a small amplitude bigger. But that's only for the reflection. When the echoes are coming back to us, it's not in a transmission mode, it's the reflection, the receiver mode, we can say. So that will be the 2D gain. And also, one more thing, these are TGCs. You guys all understand they are called, also other names for the TGCs are DGCs or SGCs. So TGC, time gain compensation, DGC, depth gain compensation, and SGC, swept gain compensation. They will go by the timing. Like we know when the sound is fired from the transducer and go inside of the tissue. So at the beginning of the picture, we do not have that much attenuation. But when they go inside to the tissue, they will slowly attenuate. They will lose their amplitude, power, and intensity. So for that reason, we have to use the time to see where we need to gain. So you look to the timing where that is. So that's why we call it TGC or depth DGC, depth gain compensation. So we know sometimes like where we need to make our picture brighter and darker. So these TGCs also make the picture either brighter or darker. It depends which way you want to turn it. To the left, to slide it to the left, it will make it darker. Slide it to the right, most commonly, it will make the picture brighter. Now, the difference between the use of the 2D gain and the TGC is that 2D gain will make the picture, the entire picture, equally either brighter, if you want to make it brighter, or darker if you turn it to the left, so that will make it darker. So that would be equally all the dots which coming back, the echoes are coming, they will receive the same amount of amplification on this case for the 2D gain. But the TGC, they will give you a different, like if you want it in a specific area to make the picture darker or brighter. So on that case, TGC works in a specific area. Now, that is the difference between both of them. And make sure that your TGC button is on. Sometimes it's off. then TGCs are off, it's not working. So today, I think this much is enough for these knobologies. We had a dynamic range, focal point, depth, 2D gain, and TGCs. Next time, we will talk about the other. So it will be a series of the knobologies to talk about them. And I think that helps, because maybe you have a lot of knobs in your machine, very valuable knobs, and very fantastic, amazing knobs. And that will make your picture amazingly, perfectly diagnostic. So you can explain your picture easily, good way, and that will make your the patient, when they come to any sign symptom and you scan the patient, so that will give you perfect diagnosis. So for that reason, try your best to share these video clips with the other friends also. And if you think these informations are important, please don't forget to subscribe the channel as well. And just wait for the upcoming videos, notifications, and we will have more knobology lectures. This way, I think I will make it easy. I will try my best. Thanks a lot and have a good day. Thank you. Bye-bye.